This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Solid. Well, just an introduction. My name is Nick. I'm one of the first-year residents at Texas Tech, and I'm excited for y'all to be here and learn a little bit more about our program. Hopefully the screen is sharing, and let's go. Cool. So just the basics. Where are we? Texas Tech. We're based out of Lubbock, Texas. We're a small college, I guess small, kind of small, not really that small college town of about 250,000 people. That's surprisingly affordable and very, very easy to live in. We're actually like the 11th largest city in Texas, so I guess not quite that small. That being said, you have a really amazingly quick commute time across the city. I think it's just about 20 to 25 minutes to go from anywhere from one point in the city to anywhere on the other side of the city, which is like a very, very stark difference if you come from major areas like Dallas or Austin or Houston. And sort of like a, I guess, unknown fact for us is that we actually produce 80% of the Texas's wine grape production. And so we're home to a lot of award-winning wineries. Our overall objective as a program is to train the next generation of physiatrists in the care of persons with disabilities in West Texas, South Texas, and the Mountain West. And if you take a look at the photo I have over here of just where we are in the sort of realm of everything in the States, we actually cover a very, very large area in terms of just medical coverage. We cover like most of South and West Texas, as I said earlier, some parts of Oklahoma, and a lot of Eastern New Mexico. Our catchment area and our case mix index is fantastic, very, very large. So just in general, Lubbock. I know. Someone's speaking. You could mute yourself. Just in general, Lubbock has a couple of points of interest. The Buddy Holly Center, we're pretty famous just for this sort of 50s rock and roll star, Buddy Holly. Also very famous for John Denver, who actually attended Texas Tech. And so there's a center named after Buddy Holly, and it sort of serves as the cultural and arts center of the city today. We also have a new Performing Arts and Sciences Center, which is the home to the Lubbock Ballet and the Lubbock Symphony. Of course, plenty of sports with Texas Tech in football, basketball, and other athletics. You know, the legendary Pat Mahomes in Kansas City is from here, and I am proud to run by. I think 2 or 3 murals actually, just kind of pasted along in university whenever I run the units. We also have access to some waterway with Buffalo Springs Lake. There's some nature trails, fishing, and boating over there as well. As you can see over here, there's a cool little like steel house, one of these artistic pursuits by one of the former professors at Tech. Ended up building the steel house that's kind of been slowly being built and partially incompleted as of today. And then you have over here what we have an annual sort of balloon festival that we have every single year. Just like to rehash the point, cost of living here is so affordable. I think like for the most part, everything is under 1.5K in terms of just renting, and you can buy homes for, I think, under $200,000, really. I was actually looking into purchasing one recently on this lake, actually, just about 200,000. So just benefits in general. Salaries here, this is an older depiction of the salaries from last year. They've been updated this year. I couldn't find like a very, very accurate one, so I just figured that I would stick with what's formally posted on the site right now. As you can see, roughly around 61.5. Currently actually getting paid 63K as a PGY1 here, which is actually very good. I think we're quite above the median for most ACGME programs. We have 4 weeks of vacation and sick leave for PGY1, 5 weeks for PGY2 level and above, and then we have 4 wellness days a year, where you get one every quarter or every 3 months. We also have an educational stipend of 2.5K over the course of residency from PGY2 through PGY4. We also have health insurance provided for each resident and their eligible dependents. And once again, just sort of to recap things, feel free to drop any questions in the chat if needed. All of my other co-residents and my faculty and attendings are actually hanging out at B-dubs right now, zooming into this, pulling for our fantasy football teams. So if there are any questions, feel free to drop them in the chat or ask them afterwards. So training site wise, we have a lot of training facilities, and I think it really speaks to the comprehensivity and the diversity of our training program and sort of the pathology that we see. So primarily our main PGY 2 to 4 training site will be Trust Point Rehabilitation Hospital of Lubbock. This is a very, very comprehensive facility that stands as one of the few inpatient rehab facilities essentially between Albuquerque and Dallas. And once again, just given how far we gather patients into Lubbock from eastern New Mexico through Kansas, through Oklahoma, and all the way to even like some parts of South Texas, we have a lot of diversity going on there. We also have Covenant Medical Center, which is one of these sort of private hospital systems in the area. We have Moody Neurorehabilitation, which is more of a post-acute brain injury neurorehabilitative setting where we have our outpatient clinic. And then we have Covenant Children's Hospital, we have the VA, we have Lubbock Spine Institute, where we do a lot of procedures, the pain fellows over there. And we have the UMC, University Medical Center, which is the county hospital system where you'll do most of your training as a PGY 1. So overall, program structure for us, we are a 4-year categorical program with 3 sort of institutions that we primarily rotate with, namely Texas Tech physicians, University Medical Center, and as I mentioned before, Covenant. So intern year for us is separated into a series of 4-week blocks, 3 blocks of those being neurology with inpatient, outpatient, and then a hybrid of the 2. 4 blocks being family medicine with inpatient, outpatient, geriatrics, and palliative medicine. 1 block is on the burn ICU and sort of burn surgery service. 1 block is with orthopedic surgery. 1 block is with internal medicine. 1 block is with hospitalist medicine. 1 block is with pediatrics. And then your final block, just transitioning into your PGY 2 year, will be your PM&R block. So as you can see, we have a pretty diverse, once again, collection of blocks to rotate through to really, really build that foundation for moving into PGY 2. As a lot of the patients that we have coming through to our inpatient rehab facility, we source primarily from UMC and Covenant. I like to draw attention to the block of burn. We are one of the few institutions that have a dedicated official sort of accredited burn facility. And as such, we do get quite a few burn rehabilitation patients coming into our Trust Point Hospital. So program structure for the PGY 2 to PGY 4 years, I like to point out that this is something that's actually still in a work in progress. We actually had a meeting this morning about how this is going. I don't want to mislead anybody, but I just want to sort of just put this out here as this is sort of the overarching schedule for what we've been working with for the past couple of years. So overall, right now we've stated as a 3-month block, essentially between PGY 2 through PGY 4, with us completing 4 of these 3-month blocks every year. Sorry, tongue twister. So you can see PGY 2, 3, and 4 have these blocks. Inpatients heavy in the first 2 years, then less so on the remaining 2. Okay, so this consists of a variety of inpatient, outpatient experiences over here. I'm just going to kind of breeze through these as these are still being worked on. We're thinking about transitioning to a 1-month block-by-block schedule, typical with other programs for the most part. But just to give you a sense of the comprehensivity of what we have and the diversity of the clinics, typical outpatient rotation for us would have a day at EMG, followed by a day of outpatient general rehab, followed by some research, followed by VA MSK clinic or an MSK clinic, then followed by wheelchair and amputee, right? And the same sort of applies to outpatient 2 as well. Outpatient 3 and outpatient 4, we sort of get you more ready for fellowship. You have more integration with pain clinics, sports medicine clinics, once again, more VA peds clinics, just sort of getting you that exposure to longer term fellowship electives over there. And then we do have some selectives as well with neurology, wounds, sports, pain, brain injury, medicine, and then just some research and academic time as well built in. Once again, just like to point out, this is all very much a work in progress. We are currently revising this into a 1-month at a time block schedule, hopefully trying to keep things a little bit more focused with each month. Okay. And then just sort of capping things off didactics wise, we do have 2 hours weekly of 4 topics, TBI, amputee, and stroke on an 18-month cycle. We have 1 hour weekly of longitudinal topics, including sort of systems, administration, leadership, and quality improvement, as well as wellness, resilience, DEI, and research. We have some anatomy, EMG, and ultrasound content being put into the pipeline. And we do have some really good connections with sports medicine as well as the pain program here. And we have sort of academic affiliations with them as well. Okay. As you can see, just a couple of photos from our recent didactics. And that's basically it. I know it's kind of brief. Just let me know if you have any questions in the chat, or you can ask them, go ahead and ask them here as well. Be sure to follow us on TTUHSC PM&R on Twitter and Instagram. And this is last week, us hanging out at B-dubs, as well as a couple of like cool little art mug events and some golfing events. But yeah, thanks for your time.